What we're going to hear is a paid private technocrat telling the board how good union employees have it. A lot of what you're going to hear is just untrue, and I'll cut in and tell you where. And we've heard this for years. There's nothing new here, but it's the latest presentation to the board in trying to get the, well, what would be the word? In trying to get more false propaganda out into the community about the way things are for the union people here. And you're not going to learn anything new, but what you'll hear is another attack on union health care benefits by another person. So watch the film. This is, it's sad. It's pathetic.
Your healthcare plans and some challenges that you're facing in this area as well. The first piece is the value of your healthcare plans, and value can be defined a few different ways. The first one is the actuarial value. This is what insurance companies would use, what Mercer would use to determine the value of your plans. It looks at the member cost share of claims that come through, so how much are they paying for co-insurance, deductibles, out-of-pocket maximums, those kind of things. What it doesn't take into account is who's paying what portion of the premium. So this is really based on the claim value of the plan and not who's paying what percent of premium out of payroll contributions. There's also a perceived value of the plan, and that is when you start to take into account what your members are looking at. So employees and their dependents that are enrolled in the plan. What value to them differs greatly by employee. Some of the things that they would consider is what provider or network you're using. Is their doctor on it? The choice and breadth of covered benefits. The plan share of claims costs that we mentioned around the actuarial value, and then also how much they're paying out of their payroll contributions for the coverage. Trimet currently offers two types of plans, PPO or Preferred Provider Organization. That's with Regents. It's a network of providers that if you go see them, they have agreed to, with their insurance company, to provide discounts, prior authorization arrangements, and no balance billing to members. So if they agree to a discount with Regents, for example, that's all the doctor gets. They don't get to come back after members to collect any unpaid balance. And they also offer non-network benefits, which means if your provider is not on the network, they can go see them, but their benefits are reduced, and they could have liability to that provider. HMO, Health Maintenance Organization, this is Kaiser for you. It's a closed network of physicians, hospitals, labs, and pharmacies. There's generally not an out-of-network benefit, the exception being for emergencies or if you're out of the service area and something would come up for the members. Utilization in an HMO is generally more tightly managed than in a PPO arrangement. So quickly touching on how Trimet's plans kind of compare to the market. And the market can be defined in a number of ways as well. So just starting with how it compares to plans in the general market, what we see in commercial business, private and public sector. Very positive in that you have lower deductibles, lower co-insurance requirements, lower out-of-pocket maximums and pharmacy cost sharing, and low or no payroll contributions for the plans.
That's false, what she just said. She said that we're not paying any premium contribution. That's completely false. And I don't know why we continually have to be bombarded with this false propaganda that we're not paying anything for our premium service, because we are. I am paying well, it went down a little bit. The last thing I paid was $183 a month, my premium charge. It's gone down. I haven't seen it, the new one yet, but it's false. She said we're not paying any premium charge. It's completely false, and here she is sitting here at the board of directors telling them we're not paying any premium charge. Now, how is it that they get away with this year after year after year? They get away with spreading false propaganda and lies. It's just not true.
Compares favorably to public employers. So we've looked at a number of local public employers that have PPO plans that compare with deductibles ranging from $0 to $500. Trimet's currently at $150. Co-insurance ranges from 10 to 20%. Trimet's currently at 10%. Out-of-pocket maximums that range from $1,000 to $5,000. Trimet's currently at $1,500. And contributions, which I mentioned just previously, is that all of the employers that we're looking at for their most generous plans do have some level of employee contribution in their paycheck. Right now, the union doesn't pay anything for their coverage.
There it is again. She's lying again. That's 2 lies in less than 1 minute. She said twice now that we're not paying anything for our premium. That's complete lie, complete falsehood. And here we are listening to blatant lies being told to the board of directors. I don't understand this shit, okay? Not only are we paying for our insurance now, but we had to pay for our insurance in 2009, 2010, which McFarland stole from us. It's theft. It's violent theft. He was ordered twice by a court to refund it. He has not refunded it. He's still holding this money. And here she is, whoever that paid hack is, lying about our free service, which is a complete lie. I can't believe the bullshit that this Trimet management puts out.
And the non-union has a 6% contribution. Another comparison is to transit agencies. And what we've shown here is the federal AV, which is actuarial value. This is based on a calculator that was produced according to the Affordable Care Act to develop what level of coverage is being provided. So we took the benefit plans for these organizations, put them into the federal calculator, and developed the actuarial value for those. And what you can see here is that Trimet's union plan is currently just under 92%. The non-union plan is at 86%. I should mention this is also just for the PPO plans, not the HMO. There's several comparable transit agencies here, ranging from a high of 92.7 to a low of 83, or 82.3, I should say.
Okay, so she's outlined several transit agencies. Who knows which one she decided to pick to show to these people? But out of the several that she's showing the board, the one that's better than us, higher level of benefit than us, as well as some that are equal benefit to us, and then some that are lower than us. So what's the big deal? So there's some that are better, there's some that are worse. So, the whole point of all of this, this is why I get so excited about it. The whole point of all of their strategic financial plan and all of these people sitting at that table is to get rid of our benefits. Now, I know that, and people that are watching this blog know that. That's the whole point of this whole charade. They don't want to just come out and say, look, we're expanding this system too much. We can't afford to pay you and expand the system anymore. We have to downgrade your benefits because you're not important. Oh, and by the way, at the same time, we're giving ourselves raises. We're talking about 6-figure executives here. They get higher salaries. We get lower salaries. But they don't want to come out and say that. They have to go through all this nonsense to try to prove to the public that they're not doing anything wrong.
The Trimet compares very favorably. This is, again, not taking into account any contributions. So when you take into account that the contributions for Trimet employees are low, it makes these values richer from an employee perspective. So part of the Affordable Care Act that hasn't yet got a lot of attention because it's been in the news for all of the stuff going in 2014 is the excise tax that is going to be applied for some call it Cadillac tax plans or high-end plans. And what this is doing is that in 2018, there will be an excise tax on the value of that plan or the cost of that plan that exceeds certain thresholds. And for 2018, the thresholds are $10,200 for a single and $27,500 for a family. What we're showing here is just the medical premiums for 2014.
This is why I didn't support Obamacare and why I still don't support Obamacare. Obamacare was nothing but a government sham to take money and put it in the private insurance industry's pocket. And the biggest sham about it is what she just said. Now they're going to impose excise taxes on people who have good coverage. Now, what kind of government program would actually make people pay a tax on their already existing insurance if they think it's better than what they should have? I mean, this is how flawed Obamacare really is. Okay, not only do they compel every American to buy it, you know, you're forced to if you don't have insurance, but they're also taxing other people's insurance. It's absurd, and this is why I didn't support Obamacare and why I don't support Obamacare. It was a phony, it's phony. If they weren't going to talk about single payer, they might as well not talk about anything and just left it the way it is. Because people are still going to be uninsured. The whole thing is a mess, as you've been hearing. And now the people that have decent insurance are under pressure to lose that because the government is charging excise tax on us. How absurd can you get?
We're not including any dental, any flexible spending account, vision, that kind of thing. So this is just the premiums for the Regents PPO and the Kaiser HMO. And what you can see is that in some cases, the current threshold is exceeded already. So if you take, for example, the Regents PPO for the union, the current annual premium is just over $10,000. So we're pretty close to what it would be in 2018 without having an excise tax. So with additional 4 years of medical inflation that might occur, we certainly have a concern.
We can hear you though.
Okay. Okay.
Speak loudly, maybe some members of our audience can hear you too.
So the excise tax, I did want to clarify that the excise tax itself is 40% of the value over those thresholds. So it's not of the entire amount, but just those that are over the threshold. So what's driving the cost for Trimet? Thought we would walk through a number of different issues here. Demographics certainly plays in. As you can see on the left, we're just looking at your Regent active employees and the Kaiser enrolled active employees. So the average employee age for the union on the Regent's plan is 51.6%. It's 50.5 years for the non-union, and the benchmark for Regents is 45.4. A difference of nearly just over 6 years can be a pretty significant difference in driving claims costs. We've also shown average member age, and when we look at members, that's your employees, their spouses, or domestic partners, and any kids that they might have. Another key factor is average contract size. So what this means is the number of noses or belly buttons that are enrolled per employee. So if I have a family of 5, that would be 5.0. A single person enrolled would be 1. So on average, your contract size in the union is 2.3. It's 2.4 for the non-union. And for the Regents benchmark, it's just over 2. And then you can see the corresponding numbers on the Kaiser side. Male and female makeup can have some impacts, but we're kind of hovering all around the same 50-50%. So I don't know that that's having much of an impact. I did want to talk a little bit about the average contract size and why that's important. What we've shown here is for the most recent 12-month period of paid claims, what the average cost is for an employee, a spouse, or their dependent children in this case. And you can see that the spouses are higher cost than the employees themselves. That statistic is not unusual. Generally speaking, we see spouses have higher costs than the employees. Could speculate about why that is, but I think it's probably different by each employer group. And then you can see that dependent children generally are much less costly than adults. Other cost drivers, the rich plan design with Regents, and what we've shown here is, again, looking at, for every $1 million of claims that's submitted to Regents, after the provider discounts are applied, making sure that the claims are valid claims. The union cost sharing prior to the benefit change that was made in September of 2012 was 3.2% of cover charges. After that change in plan design, it went up to 8.1%. So we made a pretty good jump there in how much the members are paying for claims that come through the system. And then if we compare that to the Regents book of business, in 2011 it was 12.4%, and 2012 it's 12.3%. So although Trimet made some significant progress in kind of coming in line with the commercial business, it still trails what we're seeing for Regents generally. One of the things around a rich plan design where members are not paying out of pocket for their claims is that they can lose sight of the cost of care that they're getting. So they're not as aware of going to an emergency room versus a physician's office. If it's the same cost to them, they go where it's more convenient and spend less time doing.
This was brought up in one of Stedman's comments in the past clip here, where he was saying, well, now the employees won't be rushing to the doctor every day when they have to pay for it. It's like assuming that somehow people will be rushing to the doctor because it's free. Well, I don't know anybody who likes to go to the doctor, free or not. I don't think anybody. I've never met a person, unless there's some kind of crazy hypochondriac, that actually wants to go to the doctors, okay? Nobody goes to the doctor because it's free. You go to the doctor because you're sick. But this contention that this woman is putting out here, and one that Stedman put out before, is that somehow now that we have to pay for it, we're going to use it less. Well, that's probably true. But I mean, it's not because we are using it frivolously, but because now, for example, in my case, I have to get some of my meds out of Canada, rather than even bother with the United States crap, because it's so expensive here and so much red tape. I just choose to get it from another country. Okay, I didn't have that problem when we had when we did have an actual platinum benefit. Now we don't. But this concept that somehow, oh, employees will be less anxious to use it if they have to pay for it is absurd. Nobody uses health care because it's free. They use it because they need it. The only thing you're going to get now is people that won't use it because it's going to cost them, so they'll come to work sick and be sicker.
About the cost implications of that. Another potential issue is occupation. I know there's been some discussion about the risk of occupation as the transit workers. And I'm certainly not in a position to talk about that risk. That's not my expertise. What I would say is that the Affordable Care Act called out several occupations that they consider high risk, and those thresholds that I mentioned previously can be higher for this subset of employees.
This is another abomination that beautiful Obama guy, you know, who I don't support. I didn't vote for him the second time around. No way. I did the first time, not the second time. I saw what he was after the first 4 years. They forgot to put in bus operators or transit operator as a high-risk occupation. Now, what do we have, 11 assaults in the last 2 or 3 months? I mean, multiple we know that as far as physical injury, transit operations is a very high-risk job. The powers that be have decided to ignore bus operations as a high-risk job. That's because it's not a respected profession. And, you know, anybody that goes into this field now, as far as I'm concerned, is really stupid. If you have a choice, because you're in a profession that's not respected. The company doesn't respect you. The customer's right now on the warpath, and it's getting worse. And you're going to have very little when you leave anyway. I mean, you might as well, you know, it's a 401k, which you can get anywhere. You know, that's your pension now. No more defined pension. And by the time there'll be no more retirement medical benefits. I guarantee you. This is going to be gone. So what are you, just working to live, basically? That's what you're facing, folks.
Players or employees. So that includes law enforcement, fire, emergency medical outside of the hospital, so paramedics, longshoremen, construction, mining, etc. So transit was not included in that. So we wanted to look at the utilization. I mentioned when employees start to have more out-of-pocket costs, they pay attention to what their utilization patterns are where they can. And
there's no reason to watch any more of this. You got the hint, right? You see where they're going with this. Okay, they're going to destroy your health care. And of course they're going to get away with it, because that seems to be what's happening everywhere nowadays. There's no pushback. Where's the union? The union has said, let's look for some other alternatives to Blue Cross. Let's go find something else besides this. See, Trimet has done none of that. They're like, this is what we have, this is what we're going to have, and we don't care if the costs go out through the roof. We'll just say that it's too expensive to pay for them and make you pay for it. They haven't done a damn thing to find a reasonable alternative. They're basically getting ripped off. It wouldn't surprise me if there was some kind of kickbacks going on there. So we hear what they say. They think we're getting too much. It's basically lies. It's the same lies we've been hearing for 3 years, for 4 years now, actually. And they have this whole army of people up there who are continuing to push the propaganda, and that's what you guys are facing. I mean, they've already cut my pension 20%, plus if I get sick, I have to come up with $3,000 out of my puny $7,000 a year pension. Basically, I'd be starving. Luckily, it's not the only source of income for me. A lot of people are stuck at Trimet because there's nowhere else for them to go, and they're scared, and we understand. I understand. It's not like there's jobs out there that are going to, even with no benefits, at least you're getting decent pay. And I'm sure that's what the Trimet managers are counting on at this point. The executives, okay, if we take away all the benefits, they'll still be getting a decent hourly wage after 3 years. And they're counting on the compliancy, the compliant workforce there to accept whatever they give them. I mean, right now, today, we have Boeing by a 51% vote accept the destruction of their union benefits up there in Seattle. So, I mean, the tide of history is against us. And maybe we're going to lose, and obviously we are going to lose, but at least understand why you're losing. That's why I bother to go through these videos and make these comments, is because at least I want people to understand the reality of what's happening. Don't be fooled by their nonsense, lying propaganda. Okay, the oligarchs, the ones sitting at the tables there, who are making fortunes, who will retire rich, have no problem seeing the people on the bottom lose what little they have. These are careerists, and people don't understand what careerists are. Careerists are interested in two things. It's all about them first before we get... It's all about them. Careerists, all about them, and it's all about their pocketbook and all about their career. I mean, just look at Fred Hansen, for example. Makes a few $1 million for himself, negotiates some absurd pension, and he's gone forever. Never to think of Trimet again. This is what you have. This is what you're dealing with here. You're dealing with an oligarchy of people who own Trimet, who are going to retire rich, and who have no ethical problem destroying the rest of us. And I am certain, and I'm not making this up, I'm certain that Trimet is trying to bankrupt the agency. They forced out all the old-timers like me. They made it miserable enough to get everybody to retire, so that the amount of retirement benefits paying out would start to creep up. So it looks like it gets more and more expensive, and they've just been on a roll hiring. They have inspectors all over the place. They have training department all over the place. They have so much white-shirted bureaucrats. They have so many people over there, and I believe, and I really do believe this, they're doing that in order to push up the total cost so they can pander to the public and say, look at how much we're paying for this. They're creating their own scenario, and they're doing it intentionally. Just understand what's happening. Don't be fooled by these people. We know they're liars every day of their lives at Trimet. We know McFarland has no ethics. This is the same man who gave himself a raise. He made a whole big deal about doubling the contingency budget. And the only reason he wanted to do that because he was hiding himself a raise. At the same time, he cut services and raised fares. So we know this man has no ethics. We've seen him in action. No ethics. Supported by a governor of no ethics and a board of directors, no ethics. So understand why this is happening and what's going to happen, because this is all very predictable.